know that over the next 6 months to a year, our priority as advocates has to be implementing the Affordable Care Act. And while there may be governors and state legislators that don't want to move quickly on the Affordable Care Act, fortunately the federal government will be implementing exchanges on their behalf. And so it's going to be incumbent on advocates to work with the federal government to make sure that the exchanges work for people with HIV. We also, as advocates, need to work in coalitions with other providers like hospital associations to make the case for Medicaid expansion. This is not something that the HIV community has to go at alone, but it's something that absolutely should be done in coalition with the other interest groups that believe Medicaid expansion is important. And we're working with AIDS United and other partners through the website HIVhealthreform.org to provide tools for states that are looking at Medicaid expansion and advocates in states that are working on Medicaid expansion. So please check out HIVhealthreform.org for resources. And
one of the most important aspects of the Affordable Care Act was the Medicaid expansion. And to me, that is the single most important thing for people living with HIV. We know that, at least in Texas, about 70% of our people living with HIV right now who are uninsured will qualify for Medicaid under the ACA. So we are pushing really hard to have that expansion. This would provide medications, it could provide some supportive services, and primary medical care to people, which we know is the single best thing, the single thing that people need more than anything else who are living with HIV.
This election gave me great optimism in our national goal of trying to get to zero new HIV infections. This election gives us great hope and promise. The economy has never been more scary, and the combination of what we need for HIV-specific programs through Ryan White, through HOPWA, and other programs can only be successful with the full implementation of the Affordable Care Act. So those two combinations together, the HIV-specific programs and the Affordable Care Act, and the election results give me great hope for the future, getting to zero.
Thanks.
Well, of course, it's great news that the president was re-elected, because he's the first president in American history that created a national plan for the United States, which sets measurable goals and outcomes. But we've always had bipartisan support for important programs like the Ryan White Care Act and HOPWA. Syringe access has been more difficult, but in regards to Ryan White, I really believe that we have to make the case on why Ryan White continues to have to exist despite health care reform. There will be people left out. We need community-based services. People can't get healthy just by going to the doctor and staying on their drugs if they live under bridges or are addicted to drugs or have mental health issues. So I think we really have to make a good case for why Ryan White extends. I think we can do that. In Massachusetts, we reduced new infections by 54% in 10 years. Why? Because we've got health care, so that's nationally possible. We do community-based programming and support for people so they can stay healthy. And we also do good behavioral interventions. And that's where syringe access comes in. I think we can demonstrate that we can reduce new infections and save money. In Massachusetts, we've saved $2 billion in health care costs by avoiding new infections. Let's make that argument at the national level.